Assalamualaikum everyone. Today we want to present about dengue disease can cause the body system to be disturbed. We are from group 5. Now this is our group members. The first one is Urgashini, our leader. The number metric is H22A0406. The second one is Nur Kasrin Nazifa binti Mat Nazir. Number metric is H22A0149. The third one is Nur Aina Shahira binti Muhammad Buhari. The number metric is H22A1208. The number 4 is Nur Ain binti Asmat. The number metric is H22A1121. The number 5 is Siti Nur Alia Shahira binti Madzan. The number metric is H22A0251. The last one is Muhammad Nazri bin Anwar. The number metric is H22A1090.
Dengue infection is a serious public health concern in Malaysia. In Malaysia, the number of dengue cases has increased year by year. Dengue fever is a mosquito-borne tropical disease caused by the dengue virus that is spread by several species of Aedes mosquitoes. Dengue is also a disease that can lead to system disorders in the body. Dengue fever is one of the most common herboviral-mediated outbreaks reported, with increased prevalence year after year with considerable morbidity and mortality. The study was designed to assess the clinical and biochemical parameters of dengue fever patients. A prospective observational study was undertaken among adult patients in a military hospital. 515 patients were studied and analyzed. All patients who were NS1 antigen dengue positive were included in the study. Clinical features, hematological and biochemical parameters were noted. The method of this research is to use the library research method and data analysis method. Novelty is basically an element of originality, a new discovery. It means finding what no one else has found. In this research, many innovations has been discovered and various studies have been carried out in a search of the real cause of dengue fever, which is associated with the dangerous Aedes mosquito. The potential for commercialization is very broad in determining the study of anatomy and physiology. The findings of this study are to state the problem, objective, methodology, novelty, and commercialization potentials.
Dengue is the most common arthropod-borne viral illness in humans. Globally, 2.5 till 3 billion individuals live in approximately 112 countries that experience dengue transmission. The incidence has increased manifold in India due to unplanned urbanization and migrate to on-off population to urban areas. Dengue virus is not spread directly from person to person. If we want to save life from dengue fever, then people can follow only preventive approach. According to WHO reports before 1970, only 9 countries on the world is affected by dengue virus. But now in 2016, 110 countries affected dengue fever. In India, Delhi is the capital of dengue fever. Dengue virus is more harmful for those people who have a less immune system as those with second time affected by dengue virus. Dengue is caused by infection with one of the 4 serotypes of dengue virus, which is a flavivirus. Infection with one dengue serotype confers lifelong homotype immunity to that serotype and a very brief period of partial heterotypic immunity to other serotypes, but a person can eventually be infected by all serotypes. Classic dengue fever is marked by rapid onset of high fever, retrooperative pain, diffuse body pain, both muscle and bone, weakness, vomiting, sore throat, arthritis sensation, and a centrifugal macropopular rash. Among other manifestations, a small percentage of persons who have previously been infected by one dengue serotype develop bleeding and endothelial leak upon infection with another dengue serotype. This syndrome is termed dengue hemorrhagic fever.
Alright, next we move to part which is normal function of parts of body system that are involved in the diagram and affects parts of body system after dengue disease. There are 10 of parts of body system, which is number 1 is mouth and nose. The function of mouth and nose is opening that pull air from outside your body into your respiratory system. It allows air to enter our body, then filters, rebreathes and warms and moistens the air. Our nose gives us a sense of smell and help shape your appearance. Breathlessness in patients with dengue fever can occur due to pleural effusion, acute respiratory distress syndrome. Next part is heart. Heart is roughly the size of a fist and sits in the middle of our chest, slightly to the left. Heart is the main organ of our cardiovascular system. It is the muscle at the center of our circulatory system, pumping blood around our body as our heart beats. Patients involved with dengue fever will experience low heart rate. This is because dengue is a virus that attacks the respiratory tract, and this will cause the patient to have difficulty breathing. Next, number 3 is skin. The skin is the largest organ of the body. It has 3 main layers, which is number 1 is the epidermis, second the dermis, and the subcutaneous layer. Skin provides a protective barrier against mechanical, thermal, and physical injury and hazardous substances. Among the visible effects on the skin after dengue disease of patients affected by dengue are rashes and itching. Next, stomach. Stomach is a muscular organ that digests food. It has 3 functions, which is to temporarily store food, contract and relax to mix and break down food, and produce enzyme and other specialized cells to digest food. The neurological complication in dengue infection has been hypothesized through 3 pathogenic mechanisms which are concerned with neutropism leading to encephalitis, meningitis, myotitis, and myelitis. Next will be joint. A joint is the part of body where 2 or more bones meet to allow movement. In fact, dengue fever can cause several body aches, muscle and joint pain. Dengue leaves some long-term ill effects including hair fall, alopecia, joint pain and muscle pain. Next, lungs. The lungs and respiratory system allow us to breathe. They bring oxygen into our bodies. It's called inspiration or inhalation, and send carbon dioxide out, which is called expiration or exhalation. This exchange of oxygen and carbon dioxide is called respiration. In fact, morphologically, lung tissue from patients with dengue shows interstitial edema and pneumonia, accompanied by a focal or diffusions of alveolar. Next is lymph nodes. Lymph node is a small bean-shaped structure that is part of the body's immune system. Dengue fever is a disease caused by a virus that is transmitted by mosquito. It is acute illness of sudden onset that usually follows a begin cause with headache, fever, prostrations, severe joint, and muscle pain. And the last one is intentional. The intentional are responsible for the functions of intentional are responsible for breaking food down, absorbing its nutrients, and solidifying the waste. Dengue patients can suffer dehydration due to poor appetite or vomiting, or diarrhea in some cases. The entire duration of classical dengue fever lasts for about 5 to 7 days and the patient recovers. Nose, gums, blood, in the stool or in vomiting, bleeding, spot on the skin which are seen as dark bluish black, small or large patches. That's all from me. Next, I will pass to next presenter. Thank you.
I want to talk about how does the disease happen, mechanism of disease development. The mechanism happen when a mosquito carrying the dengue virus bites a person. The virus enters the skin along with the mosquito saliva. It binds to and enter white blood cells and multiplies inside the cells as they travel through the body. White blood cells respond by producing several signaling proteins such as interferons, which are responsible for many symptoms such as fever and severe pain. In a severe infection, the production of the virus in the body is greatly increased, and many other organs will be affected. As a result, less blood circulates in the blood vessel, and the blood pressure becomes so low that it cannot supply enough blood to the vital organs. Furthermore, bone marrow dysfunction due to stromal cell infection cause a reduction in the number of platelets, which are required for effective blood clotting. This increases the risk of bleeding, another major complication of dengue fever. Once inside the skin, the dengue virus binds to Langerhans cells, a population of dendritic cells in the skin that identify pathogens. Virus enter cells through binding between viral proteins and membrane proteins on Langerhans cells, specifically a C-type rating. Meanwhile, the viral genome is translated in membrane-bound vesicles on the cell's endoplasmic reticulum, where the cell's protein produce new viral proteins that replicate the viral and begins to form virus particles. In mature virus, particles are transported to the Golgi body, the part of the cell where a number of proteins receive the necessary carbohydrates. Newly matured viruses are released by echocytosis. They can then enter other white blood cells, such as monocytes and macrophages. The initial reaction of infected cells in the production of interferon, a cytokine that greatly increases the defense against viral infection through the innate immune system by increasing the production of a large group of proteins mediated by the JAK-STAT pathway. Some dengue virus seems to have mechanisms to slow down this process.
Interferon also active the adaptive immune system. Various antibodies are produced. Some are tightly bound to viral proteins and target for phagocytosis, but some bind the virus poorly and appear instead to spread the virus to the phagocytic in compartment when is it not destroyed but can replace further.
Today I will present about when does this dengue disease happen during pregnancy. So dengue is spread through the bite of an infected mosquito. A pregnant woman already infected with dengue can pass the virus to her fetus during pregnancy or around the time of birth. Dengue can have harmful effects including death of the fetus, low birth weight, and premature birth. Then, dengue fever is a mosquito-borne illness that causes a high fever and some flu-like symptoms. If a pregnant woman gets sick with the dengue fever, she can pass the virus to her baby, increasing the risk for the complications such as low birth weight, preterm birth, and even death. Dengue fever outbreaks usually occur in tropical and subtropical regions, but there have been some outbreaks in the United States, and the infection is common in United States territories like Puerto Rico and American Samoa. 1 in 4 people with dengue fever will become sick and experiences mild or severe symptoms. Mild symptoms usually go away on their own, but severe symptoms require medical attention. Dengue fever is a mosquito-borne illness that causes a high fever and flu-like symptoms. It's usually short-lived, lasting about 2 or 7 days. People who get sick with dengue fever usually have mild symptoms, but sometimes they can be severe or fatal. Like other mosquito-borne illness such as Zika and chikungunya, dengue fever can be problematic during pregnancy because women, especially those in their 3rd trimester, can transmit the virus to the baby. This can put them at risk for low birth weight, premature birth, and even death of the unborn baby. So dengue fever is also associated with preeclampsia, high blood pressure, hemorrhaging, low platelet count, and cesarean delivery. Babies infected with dengue are at higher risk for a severe case of the disease. After that, Zika virus associated microcephaly. When a pregnant woman is infected with Zika during her pregnancy, maintenance transmissions of the virus to the developing fetus can result in microcephaly as a consequence of death of cells in the brain of the fetus. Primary transmission factors include Aedes aegypti and Aedes albopictus. Next, we can go to dengue fever symptoms in pregnancy. Dengue fever pregnancy can cause mild or severe symptoms. Mild dengue fever symptoms include high fever, nausea and vomiting, dengue fever rash, usually in the palms and soles with itching and swelling, eyes, muscle and joint pain, swollen glands, and lastly headaches. So, my symptoms should clear out within 2 to 7 days, but severe cases of dengue fever, also known as dengue hemorrhagic fever, require immediate medical attention. If not treated, it can lead to shock sudden drop in blood pressure, internal bleeding, and death. Severe dengue fever symptoms tropical start 24 to 48 hours after your fever breaks. So there are some signs of severe dengue fever. Some signs of severe dengue fever are severe belly pain and tenderness, vomiting at least 3 times within 24 hours, bleeding from the gums or nose, difficulty breathing, blood in vomit, urine or stools. And lastly is fatigue, restlessness and irritability. So it can be challenging to diagnose dengue fever because it shares many of the same symptoms can mosquito-borne illness like chikungunya and Zika, and even malaria and typhoid fever. So, in conclusion, is pregnant women should especially follow utmost caution and practice good measures to stay protected as well as keep the unborn baby safe.
Today I want to present about how to prevent from this dengue disease and the conclusion part. How to prevent from this disease? Test before vaccination. Dengue is the only dengue vaccine approved by the US Food and Drug Administration and is recommended for routine use by the Advisory Committee on Immunization Practices. It was developed by the Sanofi Pasteur. The vaccine prevents dengue caused by all 4 dengue virus serotypes. Dengue will be available starting in 2022 for use in children and adolescents 9 to 16 years old who have laboratory confirmed previous dengue virus infection and are living in an area where the dengue is endemic, occurs frequently or continuously. Dengue endemic areas include the US territories of American Samoa, Puerto Rico, and the US Virgin Islands, and freely associated states including the Federated States in Micronesia, the Republic of Marshall Islands, and the Republic of Palau. The vaccine is a tetravalent and leaf-attenuated dengue vaccine. It was constructed using the recombinant DNA technology and replaces several genetic sequences in a yellow fever vaccine virus genome with the homologous sequences from the 4 dengue virus serotypes. Laboratory confirmation of previous dengue infection is required for dengue vaccination. A pre-vaccination test will confirm whether your child has had dengue fever. For children who do not already have dengue vaccinations increase the risk of hospitalization and severe illness if the child develops dengue after vaccination. Therefore, to reduce the risk of vaccinating children who have never had dengue, a blood test can be used to check for pre-dengue infections. If the test result is positive, your child can be vaccinated. If the test result is negative, your child cannot be vaccinated. Your child should be tested again in a year or 2. Talk to your child's healthcare provider to find out if your child is eligible for dengue vaccine. Types of testing to confirm a period dengue infection. Your child's healthcare provider will order a blood test to confirm a previous dengue infection. The healthcare provider will order a test approved by the local and regional health department. Moreover, if your child has previously had dengue and it has been confirmed by a specific type of laboratory test, your child may not need additional blood test. Child need 3 doses of the dengue vaccine for full protection. Dose 1 can be given after confirming that your child had a period dengue infection. Dose 2 is given 6 months after the first dose. Dose 3 is given 1 year after the first dose. The dengue vaccine requires 3 doses administered subcutaneously and given 6 months apart for full protection. Who should not get a dengue vaccination? Children under 9 years of age. Children under 9 years of age are less likely to have had a period dengue infection. For this reason, if your child is under the age of 9, they are not eligible for dengue vaccination. People over 16 years of age, the dengue vaccine is not licensed for people over 16. There is not enough data to show how well the vaccine works in that population. Children who have not had a period dengue infection, children who are immunity defensive, travelers and non-residents of areas where dengue is common, the FDA has not approved dengue vaccine for use in travelers. The vaccine provides year of protection. We are still learning about how long the vaccine protects children. To date, we know that the vaccine can provide protection against the dengue fever for at least 6 years. Over time, we will learn more about how long vaccine protection lasts. The vaccine is safe and effective in children with previous exposure to dengue. Dengue vaccine protects children from dengue 8 out of 10 times before vaccination. Although the vaccine is highly effective, some people who are vaccinated are still at low risk of contracting dengue. This is called vaccine progress. There are 7 ways to prevent from mosquito bites. The World Health Organization stresses that vaccination is not an effective tool to reduce dengue fever in areas where the disease is common. Preventing mosquito bites and controlling the mosquito population are the main methods of preventing dengue fever. For the first step, stay in air-conditioned or well-screened homes because mosquitoes that carry the dengue virus are most active from dawn to dusk, but they also bite at night. For the second step, wear protective clothing. For example, wear long sleeve shirts, long pants, socks, and shoes when visiting areas with high mosquito populations. For the step 3, reduce mosquito habitat. Mosquitoes that carry the dengue virus typically live in and around homes, breeding in stagnant water and collecting on things like used automobile tires. For step number 4, removing mosquito breeding sites can help reduce mosquito populations. For example, at least once a week, empty and clean containers that hold standing water, such as planting pots, animal feeders, and flower vases. Cover standing water containers between cleanings. For step number 5, protect your screen from mosquito bites. If you live in an area where dengue is endemic, use electric mosquito repellents to protect your screen from mosquito bites. If you are going outside, use insect repellent sprays to protect exposed skin. Make sure they contain enough properties to repel mosquitoes and that the ingredients are safe to use on the screen. For step number 6, avoid smells that attract mosquitoes. Smells such as sweat and perfume attracts mosquitoes like moths to a flame. Bath frequently to remove sweat and use unscented perfumes and creams. For step number 7, time your outings. You don't have to catch dengue fever at home. It can happen during your camping trip on a wet day or even when you are walking in the woods on a rainy day. Depending on the weather, take your trips with you, starting with creams, netted sleeping bags, and several mosquito repellent weapons. For the conclusion part, dengue fever is a derided disease and a growing public health problem. The rapid increase in unplanned urbanizations lead to more mosquito breeding sites and therefore more people are affected by the Aedes aegypti mosquitoes. These include semi-urban and slums areas where household water storage is modest and solid water disposal facilities are inadequate. The urgent need for vaccination to reduce morbidity and mortality from this disease has been recognized in years in a cost-effective manner. As epidemic transmission of dengue continues in today's world, the development of safe, cost-effective and feasible preventations and control measures, including the development of new and improved vaccines, promise to reduce dengue virus infections. As strategies evolve and are used in a coordinated manner with other methods, improved combinations also predict vector populations declines. Among the vaccines developed, the approbations of recombinant leaf and attenuated tetravalent dengue vaccine has proved safe and tolerable, as well as protective against dengue. With more research and experimentations of novel methods and techniques, the future could enjoy better control with protective immunity to dengue.
Okay, so that's it from us. Thank you very much.